Hi, let's talk about in vitro fertilization. In 1978, the scientific world had a breakthrough. Louise Brown was born. She was the first IVF baby. Since then, hundreds of thousands of couples have gone ahead to have their babies through this procedure. For couples in which conventional first-line treatment for infertility has failed, or in clients with tubal factor infertility, in vitro fertilization offers hope for them. IVF is recommended for couples with advancing or advanced female age, with poor egg quality, couples with unexplained infertility, couples with damaged or blocked fallopian tubes, male factor infertility, females with recurrent miscarriages, and women with problems ovulating. Couples with genetic challenges in their families could also benefit from the IVF service. The IVF procedure involves the following steps. The first step is the ovulation induction process. The woman is given daily injections of drugs called gonadotrophins to stimulate the growth of multiple eggs. Normally, every woman produces one egg at the time of ovulation. However, the drugs aims to help produce many more eggs to increase the chances of a pregnancy occurring. The injections are administered for about 9 to 12 days. And while taking this injection, several times ultrasound scans are carried out to monitor the growth of the ovaries and the response to treatment. When the doctor decides that the eggs are large enough, HCG, or the human chorionic gonadotrophin, will be administered to cause the final maturation of the follicles. The next stage will be the retrieval of the eggs. The eggs are expected to mature 36 hours after the HCG injections and be ready for retrieval from the ovaries. The egg retrieval involves the removal of the eggs from the ovaries using a long ovum pickup needle attached to a transvaginal ultrasound probe. The procedure is carried out under some form of anesthesia to ensure that the woman does not feel the pain of the procedure. A few hours after the procedure, the client is ready to go home, and the client is given progesterone suppository to insert into the vagina. Progesterone helps prepare the lining of the uterus for the implantation of the embryo. The next stage will be the insemination of the eggs. On the day of your egg retrieval, your male partner is expected to provide fresh semen sample to the laboratory. He should produce the sample at the home or in the hospital. Using special media, the eggs and the sperm will be placed together to enable the sperm fertilize the eggs, and they will be placed in an incubator to enable development. For the next 3 to 5 days, your embryologist will monitor the growth of the embryo, assessing their growth and quality, and deciding which ones are best for transfer subsequently. The client will be updated on the progress of the embryo during this period. Clients do not need to present to the hospital during this period. However, the woman is counseled to continue her progesterone insertion as recommended. Embryo transfer is usually done on day 3 or day 5 after the retrieval of the eggs, depending on the protocol of the clinic. Most clinics favor a day 5 transfer. For the transfer, the best quality embryos are utilized, and your doctor will discuss with you on the number of viable embryos to be transferred back into the womb. In most cases, 2 to 3 embryos are transferred back into the uterus. In countries like the UK, a single embryo transfer is done to reduce the risk of multiple pregnancies. The transfer, which is a painless procedure, involves loading the embryo into a special catheter and under ultrasound guidance depositing it gently into the uterus. The client will be advised to remain in bed for about an hour after the procedure, and then she can go home and resume normal activities. After the transfer of the best looking embryos, there may still be some excess embryo remaining. Any unused high quality embryo will be frozen to allow the option of future implantation. Your doctor would need your consent to freeze these embryos, and the terms of freezing would have been discussed with you during your initial consultation. After an embryo transfer, you'll be counseled to continue your progesterone insertions at home, and you'll be advised not to engage in any strenuous activity outside your routine. 2 weeks after the procedure, you'll receive a call to present at the clinic for a blood pregnancy test. If the pregnancy test is positive, the client will be counseled to continue the progesterone injection for about 11 weeks when the placenta begins to produce enough of the hormone to support the pregnancy. An ultrasound scan will be done in the 6th week to check for fetal heart activity. If the pregnancy test is negative, your health team will discuss with you the possible reasons why this occurred, and you may choose to have another IVF cycle.